And boom, there we are. All right. Hey, everybody. Welcome back to the Lunchtime Live. We do here every Monday. I am Daniel Tribby alongside Dr. C. How we doing today?
Good. How are you doing?
Good, 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 good. We're the owners of Regenerative Sports Spine and Spa here in the Orlando area. Excuse me. And today we are going to jump into some rotator cuff stuff. I know a lot of people, this is a common thing that happens in shoulders. We're going to talk a little bit about what the rotator cuff is, what happens when it's actually torn, what are the common treatments, and then what out there could be better for treating your rotator cuff tear. So, if you're jumping in, you're joining us, drop a comment. You have questions about your rotator cuff issues. If you've had rotator cuff procedures, anything like that, we want to know about it. Ask questions. If anything we talk about is relatable, definitely drop a comment in there. We would love to answer any questions that you guys have about rotator cuff tears. So let's jump in. Doc, what is the rotator cuff? What actually is that?
The rotator cuff is basically a collection of tendons that help stabilize the shoulder joint. I have the joint here today. So this basically, I don't know if you can see that. They're see-through things here. It's like, and then they attach and then give mobility and stability to the arm and shoulder.
Right. So it's a group of 4 muscles, right? And so they all do exactly what the name tells you they do. They're rotator in nature. They allow you to rotate through different ranges of motion around your body, behind your back, when you throw, all rotational stuff, hence the rotator cuff. And it is a rotator cuff, not a cup or a rotisserie cup or any of the other weird names that we hear this called. It is a cuff, C-U-F-F. It's a group of muscles. And the most common one we have problems with is called the supraspinatus, right? Can you show us where that lines up in the model there? The supraspinatus if you have to turn it that way, just so we can see like the top of the scapula. I want to see where the muscle is as it runs underneath.
Like that?
In the fossa. So I want to see the full top of it. There you go. So this groove right there is where the supraspinatus sits, right on top of the scapula. There's like a hole there. And then the supraspinatus runs underneath where your collarbone connects out to your shoulder, right? And then that tendon, show the tendon for the supraspinatus, comes down and connects, yep, right there. Comes down and connects around the outside of the shoulder there. So that supraspinatus is 90% of the time the one that gets damaged when we have a tear. So what does it actually mean when you have when that muscle is torn? Like, what's a rotator cuff tear? What does that look like, Doc?
Well, it depends on how much is torn, right? It's like you can have minor, like micro tears. You can have a whole partial tear where half of that is torn and then comes off the bone, or you can have a full tear where that's completely off the bone there and is not supporting the joint there. So right. It's like it can be any one of those and different degrees of each. So it's like it's not really just one thing or the other. So, yeah.
And a lot of people relate tears as like, if I have this piece of paper and it, like, that's not exactly how the tissue tears. The tissue tears more like if this was our tendon, it's going to tear more like this through that thickness of the tendon rather than tearing like that. So when that happens, what are some of the symptoms that we get?
I mean, definitely pain with movement of the shoulder. Mostly, it's like some people have pain when they're laying on that shoulder at night, with any activities, things like that. So,
right. Yeah. And then traditionally, when people have a rotator cuff tear, they're going to go to the doctor, get the MRIs, do all the things, and then when they start doing the treatment portion of it, what does that protocol typically look like?
So typically you start with pain medications, anti-inflammatories. That's usually first step, followed by physical therapy. That's pretty much what it should be, but a lot of us end up skipping that part and then going into a steroid injection. Especially if your pain is severe, sometimes that's one of the first things along with medications that you might end up getting. But really, realistically speaking, we should start with physical therapy first as the best course of action. See if we can get that tendon less stressed and less painful for you.
Right. Improve the mechanics, hopefully, and then that tear becomes something that is just obsolete. But what if it doesn't work? What if you have to have this tendon or this portion of this muscle fixed, or you have to do something else? Then we're typically talking about injections first, like maybe doing a steroid to see if that helps, But beyond that,
Well, typically, yes. I mean, you can do a steroid injection that does help temporarily, but as we've talked about in previous lives, is that the steroids can actually, even if you don't have a cartilage issue, it can actually cause cartilage damage over time, as well as it's like if you do have a partial tear and you don't know it, what happens is that tendon also gets weaker with the steroids, and so you may actually tear it more. And so you may actually be putting yourself up for further damage rather than really helping the problem. So we try to avoid the steroid injection if possible now, because these studies have just come out probably in the last, a couple of years, Daniel?
mhm,
Right?
yeah,
Yeah. So,
yeah.
yeah.
And then,
Hmm.
so with the steroids causing damage, right? And people still will do these over and over and over again. They'll do 2, 3 different types of steroids, and or not types, but 3 different injections for over a series of time, and it doesn't get any better. And then potentially, like you mentioned, the research is showing that you might be causing further degradation of the tissue by overusing the steroids.
Right.
So in that case, surgery is your next step, right? You can't get over the pain. The shots didn't work. The medicines didn't work. The PT didn't work. And now we're going to open the shoulder up and we're going to go fix this muscle. We're going to, so when you fix this, they actually drill into a portion of your bone and put an anchor in. And then that anchor has sutures or stitches on the end of it. And they use those to tie back through the muscle and pull the tear together and allow that muscle to heal. Now, this usually you're looking at 6 to 9 months of rehab after this surgery. And in some cases, like you have to have it. So, what would you say? What's the percentage of tear that would require surgery? Like, there's nothing else you can do. You got to have surgery.
Oh, it's got to be at least, 75 to 100%, fully torn, that kind of thing. If you're
Yeah.
anywhere less than that, then, we would definitely recommend more like regenerative medicine to try and help that area heal better. Because, yeah, like Daniel said, it's 6 to 9 months of rehab and healing, which is a lot of time, especially if you're, active person. So it's like, can we really afford that much time of downtime?
Right. You're
So,
probably going to lose time from work. You're going to have to go through all the things that happen when anytime you have an orthopedic style of surgery. And I think a lot of people are under this impression that I can have a surgery and it's immediately going to be better. I'm going to be good to go. But you're looking at, for rotator cuff tears, you're looking at 6 to 9 months before you really get back into a normal groove of things, depending on how much tissue was damaged and how much repairing had to be done. There's
right.
some of that surgery, they have to shave some bone away to give you more space, so you're not pinching on that tendon as it heals. Some people might have some other issues that are corrected while they're in there, and this ultimately just adds time to your rehab process. So if you are thinking about, well, what do I do if I shouldn't have surgery unless it's completely torn? What do I do with the 75% and less?
So that, like we talked about, either do PRP, platelet rich plasma. If you guys don't know, we get it from your blood, spin it down, get growth factors and anti-inflammatories. However, studies have shown that that's not really strong enough to help with that tendon repair as much, especially if it's a large one.
Mm,
So we do recommend more mesenchymal stem cells from bone marrow, which can be really helpful. And those stem cells are blank cells that can become what you need them to be a lot of the times and can help repair
mm,
things like this rotator cuff tear and things like that. So there are options, especially for those of you who can't have surgery, don't want surgery, those kind of things as well. And some people shouldn't have surgery. So these options are there, which may be better in the long term. Especially because it does give you long-term relief. It's not something that's going to be like steroids. You get a few weeks of relief or a few days or whatever it is, and then that's it. So this is
mm.
actually trying to help repair as much of the problem as it can, and then you're in a better position to start, so that you can get back to your activities and do what you want to do, and those kind of things. So yeah.
Yeah. And then the idea behind the regenerative medicine, obviously, is to allow your body to do its thing from a natural healing standpoint. Our bodies are really, really good at healing themselves. But the issue is that the building blocks that are required to rebuild tissue right, are often dormant in our bodies, right? We
Right.
get to a certain age, and the body uses stem cells to grow as we're moving through adolescence and all those things. The body uses stem cells to make us taller, stronger, bigger, whatever, right? So, but when you get to a certain age and the body's done growing musculoskeletally, those stem cells become dormant and they're no longer building. So, in order for us to repair some of these tissues, like a rotator cuff or a cartilage issue, you have to go get the stem cells, which typically, like you mentioned, are in the bone marrow. We're going to pull these from your pelvis, and then we can put a concentrated dose of them directly into that rotator cuff, and we're supplying that muscle with everything that it needs to heal on its own. We don't have to cut you open and go through all the trauma, if you will, of having a surgery that then you have to wait 6 to 9 months to recover from. So, but what is the longevity from a healing standpoint, like using bone marrow? Like if we use bone marrow stem cells to help heal a rotator cuff tear, like what does that length of time look like? And we mentioned, 6 to 9 months surgery, rehab, time off work. What's the other side of it on our end from a stem cell perspective?
Um, well, repair also takes time, so it's not going to be it's like a week or two later and then you're golden. It's like it does take time to help with your body get that area repairing as much as possible. So typically we see anywhere from 3 to 6 months, but we can typically get you back to activities between 1 and 3 months. So it's like it's a much less downtime, and you're not going to typically have to take time off of work, maybe a few days, and that's really about it.
Right.
So it's a really much less invasive treatment for you than surgery. So,
And then as far as physical therapy goes, like I know everybody's, oh, everybody wants to push physical therapy and it's not sexy, it takes time, like, but this is still something that we have to introduce back into the plan, right? We can't just have this shot and it's a magical juice and then we're off to the races, right? Like there's some therapy that has to come along with this, correct?
absolutely, because if you don't correct the functional issue, then this can actually just happen again, in the future, and then you're in the same spot that you were before. Because you can always have new injuries, even if we can get the original injury better, right? So the physical therapy really is essential because we do need to stabilize that area, so you're not putting as much stress on that rotator cuff. So
Right.
yeah.
And then you're making the area more conducive to healing, right?
Right.
I think there's this um, incorrect thought that we can influence the body to heal at a certain rate, and unfortunately that's not the case. Your body has its own rate of healing
Right.
based upon your genetics, right? But what we can do is make the situation most conducive to healing at its most efficient pace, right? So if we're just sitting at home not doing anything to help, we're not really influencing the body to heal.
Right.
So in combination with the stem cells or providing this regenerative juice to heal your body, we also have to be doing the exercises that make the area uh, ability to have the area has the ability to receive this stem cell and really produce the reconstruction and the healing process that's involved in that, right?
Right. Absolutely.
Yep. So how long does this procedure take if we come in and have it done?
Actually, about an hour and 15 minutes total, because we're not really doing anything to it because it has all the essentials in the bone marrow itself. So literally, we take it from that pelvic area, just filter it just to make sure, and then maybe concentrate it, and then re-inject it. So that's it. There's nothing added to it. It's all the great regenerative soup that's natural in your body. We're just putting it in the area that it's going to help the most.
Right.
So that's it.
There's
So
no, yeah, there's no hospital stay. There's none of the other madness that comes with this, right?
right,
No,
absolutely.
no being put to sleep. Like you don't have to be knocked out, and wake up from heavy anesthesia, anything like that.
Nope. I mean, it's like we do a light sedation, and it's like it sounds like it'd be painful, but it's really not. Most of my patients are, it's like really or barely even sedated, and they do great. I've had some patients do it without any sedation whatsoever, and they do fine too. So it's like it's really not as bad as it sounds. Going into your bone marrow. It's not. It's not as big a deal as it sounds. So don't be scared of the procedure. It's like it's absolutely worth it to do.
Right.
So.
Good deal. Awesome. And how many of these would you say you have done, just as relation to the shoulder?
Just I I don't have a number in my head, but I've been doing it for the last 7, 8 years. And so at least a couple a month, I'd say. I mean, you do the math on that.
Right.
So it's like, it's been a long time. So,
Quite a
uh,
bit.
yeah, quite a bit. Definitely aged myself right there. So, or dated myself, is that what they say?
What's the and what's the outcome that you've seen in our office for rotator cuff using bone marrow?
It's amazing. People get so much better. I've had, it's like typically we get anywhere from 60 to 90% improvements in the original pain, but with rotator cuff especially, we do a really good job. And a lot of people, I mean, we've had closer to the 90% improvement in the symptoms than the 60. So it really depends on what's going on as well. The full, it's like damage that we're talking about, of course, but yeah, we get amazing results with this.
Yeah. And we've even had some people who were about to have surgery and they canceled their surgery that week, went with this procedure and never ended up having to have the surgery, right? So we've avoided the
Right.
surgery. They've got 90 to 95% better and they've returned to all their activities I mean, we've had a gentleman that likes to work out and was a swimmer and couldn't do any of the above without pain and canceled that surgery, did this procedure, back to doing all things and never had to go through that surgery. So this
Right.
is something that works. And then if we ever had, like, how do we know that it actually healed? Like, how do we know, other than people's pain gets better, their symptoms go away, like, how do we actually know that people are getting better after this procedure?
Well, I mean, we can definitely do a repeat MRI, but that's not for 9 months to a year because typically it takes that long to get the full regenerative process, right? So that's kind of what we do. Yeah, so that's how we would know.
Perfect. Awesome. Well, this is a great conversation on rotator cuffs and how we can get them better without all the typical steroids and surgeries and medicines and all the things. So if you're watching this either now or post and you know somebody that's having shoulder issues or you yourself are having shoulder issues, we want to be able to help you get well naturally without the surgery, without the long-term 9 months of recovery and physical therapy. Okay. If you're in the Orlando area, we can definitely take care of you. We are Regenerative Sports Spine and Spa. You can find us just about every place under the planet as far as social media goes or online. And if you're not local to the Orlando area, we do have an awesome VIP package that gets you into town, gets you set up at a really nice place to stay, provides transportation to and from our office. And so we want to help you guys heal naturally without all the chemicals and the surgeries. Doc, you got something else to add?
Yeah, I do. I have one more thing. It's like, so we talked about partial tears and micro tears, but even if you have a full tear of the rotator cuff, this procedure can still help you because I actually had in the recent month, I had a couple of patients come in who've had this rotator cuff fully torn for a year or more. And by that time it scars down. It's really hard to even have surgery at that point. So we can still help with the pain and function of the shoulder joint without, it's like actually reattaching that tendon. So it's like, even if you're fully torn and it's been a while and you've been told you can't have surgery or it won't work, come see us. We can still help you.
Absolutely. Great. All right. We'll see you guys again next week. I think we're going to jump into some hip stuff next week. So today was all about rotator cuff tears and how we use regenerative medicine to help them heal. If you're watching it now or you're watching it after the live, please drop your comments in there. We'll go answer your questions about rotator cuff tears and how stem cell therapy can help you. And then next week, we're going to jump into hip related issues. So come back next Monday, 12:15, right here on this page. Every Monday, we're dropping value on typical bone, muscle, joint, and spine problems and how they can be healed outside of the normal, regular medical office BS and actually using something natural in our own bodies that helps us heal. So take care, everyone. We'll see you guys next Monday.
Thanks,
See you
guys.
later.